Gormago Cahirloch agus Fáilte Rivan Tara Rish. Minister, thanks for taking this topical issue this evening. I suppose since I got elected, even as a councillor back in 2014, I've encountered some of the strongest, most resilient people and families that I've had the privilege to get to know. Many of these people have suffered from acute brain injuries, spinal injuries, many resulting from accidents, farm accidents, road accidents, and so on. And I suppose it's with admiration that I look upon those people that have suffered from those traumas and their families, and the work that it takes, not just medically but mentally, to get people's lives back on track. And I suppose I brought this topical issue to the floor this evening because I suppose there's a number of reviews and reports that have been compiled since 2012 in relation to the South-South-West Hospital Group. And the South-South-West Hospital Group is responsible for approximately 1 million people in its catchment area across the counties of Cork, Kerry, Waterford and South Tipperary, over 20% of our country's population. But unfortunately, they have no access to the full range of rehabilitation services akin to what is provided for in the National Rehabilitation Centre in Dún Laoghaire. So unfortunately, many of those people, and it's quite difficult to get a place, as you know, in that rehab centre in Dún Laoghaire. Many can be waiting 6 to 12 months to get a place in the unit up there. But back in 2017, Dr. Andrew Hanrahan undertook a review of rehab services within the South-South-West Hospital Group. A further review was taken in May 2019 and outlines the requirements for rehab services in the South-South-West. In 2012, a regional specialist rehab unit was first proposed for the South-South-West Hospital Group to provide for patients with high to moderate intensity in patient rehabilitation. This unit was to support patients with moderate to severe physical, cognitive and or communicative disabilities. Services will be provided by trained rehab staff, rehabilitation medicine consultants supported by consultant neurologists. The review also recommended the development of a full range of rehabilitation services in the South-South-West Hospital Group, and that was back in 2012. 8 years on, Minister, I'm asking that you make this aspiration a reality for the people of South-South-West. I welcome tonight, in response to a parliamentary question, a letter from Mr Jerry O'Dwyer, CEO of the South-South-West Hospital Group, who has said that discussions are progressing in relation to the development of a rehab unit in Cork, and an announcement will be made in the next few weeks. I welcome this. This announcement is most welcome, particularly for those families in Cork, Kerry, your native Waterford, and South Tipperary, who heretofore have been waiting for admission to the National Rehab Centre in Dún Laoghaire, some waiting up to 12 months for admission. The people should be cared for in their own region, particularly in a COVID-19 context. It makes no sense that patients from the southern region would continue to travel to Dublin for specialist treatment that can be provided locally. While I welcome the announcement of the rehabilitation unit being progressed, I would urge the Minister, in the meantime, to accede to requests made by consultants in CUH for the provision of the required specialists who deal with trauma to be sanctioned. They are looking for additional rehabilitation consultants, speech and language therapists, physios, amongst other specialists. If this team could be put in place before the construction of a new rehabilitation unit, we could make a huge difference to the lives of people who suffer from such debilitating diseases and serious traumas. There actually is an application currently with the HSE for the provision of that team, distinct from the application from the unit. So I would hope that the HSE would look favourably upon that as well. And I'm going to share my remaining 2 minutes with Deputy James O'Connor after the Minister replies. Thanks.
I would like to thank the Deputy for raising this issue and giving me the opportunity to provide an update to the House in relation to the development of regional rehabilitation services in South-South-West Hospital Group. This is a really important issue for all of those who live in that particular area. Rehabilitation is a critical component of any modern healthcare systems, and one that is essential if patients are to regain or maintain their quality of life after serious illness or injury. Rehabilitation improves health outcomes and reduces disability. There is a growing body of evidence that rehabilitation in specialised environments is not only effective, but it is cost-effective. This has been demonstrated in a variety of settings, such as inpatient units and community teams, and in different diagnostic groups such as trauma brain injury, stroke, multiple sclerosis and acquired brain injury. The demand for rehab services is growing, and it is anticipated to grow to continue to grow with changes in populations and with the advances in healthcare and new interventions and technology. The National Clinical Programme for Rehabilitation Medicine Model of Care, which was launched in 2018, presents, in line with the National Policy and Strategy for the Provision of Neuro-Rehabilitation Services in Ireland 2011 to 2015, an outline for future provision of specialist rehabilitation services in Ireland. The model of care proposes a hub-and-spoke model consisting of a territory centre linking at least 4 managed clinical rehabilitation networks, each one serving a population of about 1 million. The network will connect acute and post-acute rehabilitation units and community specialist rehabilitation clinicians in a formal governance structure to allow delivery of coordinated rehabilitative care for patients across all levels of complexity. The HSE has advised that a review of rehabilitation services in the South South West Hospital Group, as you said, Deputy, was undertaken in February 2017 and was further updated in May 2019. The review outlined a number of recommendations in relation to the development of rehabilitation services in the South South West Hospital Group. The HSE has also advised that, in line with the model of care for the provision of rehabilitation medicine in Ireland and the neuro-rehabilitation strategy, the review recommended the development of a regional specialist rehabilitation unit for the South South West Hospital Group to support patients with moderate to severe physical, cognitive and communicative disabilities. The HSE has further advised that the review recommended the development of a full range of rehabilitation services in the South South West Hospital Group, including hyperacute rehabilitation, as well as associated specialist post-acute inpatient rehabilitation units. The HSE has advised that these units will operate in a hub-and-spoke model, and the National Rehabilitation Hospital in Dublin, through managed clinical rehabilitation networks, which is consistent with the model of care for rehabilitation medicine.